pasukan berganding tangan, bertingkatkan taraf kesihatan. Secara profesional khidmat diberi, kecemerlangan matlamat kami. Dimanapun jua di setiap waktu, kami sedia membantu. Kami penyayang pada semua, bagi kami tiada beza. Bertanggung jawab amalan kita, kesihatan dan maruah dijaga. Bangsa yang sihat aset negara, kualiti hidup dipelihara. pasukan berganding tangan, bertingkatkan taraf kesihatan. Secara profesional khidmat diberi, kecemerlangan matlamat kami. Dimanapun jua di setiap waktu, kami sedia membantu. Kami penyayang pada semua, bagi kami tiada beza. Bertanggung jawab amalan kita, kesihatan dan maruah dijaga. Secara profesional khidmat diberi, kecemerlangan matlamat kami. Dimanapun jua di setiap waktu, kami sedia membantu. Dimanapun jua di setiap waktu, kami sedia membantu.
Saya memainkan peranan saya, anda memainkan peranan anda. Duduk di rumah.
Saya tahu di mana anak-anak saya berada sekarang. Di manakah anak-anak anda? Jaga mereka, jangan benarkan mereka keluar. Tolonglah duduk di rumah.
Anda mempunyai pilihan. Jika anda memilih untuk berada di rumah, anda akan menyelamatkan nyawa. Jadi bantulah kami, tolonglah duduk di rumah.
Kita sedang menghadapi krisis
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera dan selamat petang kepada semua rakan-rakan media. Bersama dengan saya adalah Datuk Dr. Rohaizat, Dr. Hisham Shah dan Datuk Dr. Chong. Ketiga-tiga mereka adalah timbalan saya. Dan saya mulakan, Kementerian Kesihatan Malaysia ingin memaklumkan bahawa terdapat 222 kes yang telah pulih dan discharge pada ward pada hari ini. Ini menjadikan jumlah kumulatif kes yang telah pulih sepenuhnya daripada jangkitan COVID-19 dan telah discharge pada ward adalah sebanyak 1,830 kes, iaitu bersamaan dengan 42.11% daripada jumlah keseluruhan kes. Sehingga 10 April 2020 jam 12.30 hari, terdapat 118 kes baru yang telah dilaporkan. Ini menjadikan jumlah kes positif COVID-19 di Malaysia adalah sebanyak 4,346 kes. Ini bermakna bilangan kes yang discharge hari ini adalah melebihi bilangan kes yang baru dilaporkan. Sehingga kini seramai 69 kes positif COVID-19 sedang dirawat di unit rawatan rapi. Daripada jumlah tersebut, 40 kes memerlukan bantuan pernafasan. Daripada maklumat terkini yang dilaporkan kepada CPRC Kebangsaan, duka cita dimaklumkan bahawa terdapat pertambahan 3 kes kematian berkaitan dengan COVID-19. Justru jumlah kumulatif kes kematian COVID-19 di Malaysia adalah sebanyak 70 kes bersamaan dengan 1.6% daripada jumlah keseluruhan kes. Kes kematian ke-68 iaitu kes 694 merupakan lelaki warga negara Malaysia berumur 62 tahun dan mempunyai latar belakang penyakit kencing manis. Beliau mempunyai sejarah kontak rapat dengan kes positif COVID-19 daripada kluster Seri Petaling, iaitu kes 159. Beliau telah dirawat di Hospital Queen Elizabeth, Sabah pada 17 Mac 2020 dan disahkan meninggal dunia pada 10 hari bulan April 2020 jam 8.21 pagi. Kes kematian ke-69 iaitu kes 4229 merupakan lelaki warga negara Malaysia berumur 77 tahun dan mempunyai latar belakang penyakit kencing manis. Beliau telah dirawat di Hospital Kuala Lumpur pada 27 Mac 2020 dan disahkan meninggal dunia pada 10 April 2020 jam 4 pagi. Kes kematian ke-70 iaitu kes 4230 merupakan perempuan warga negara Malaysia berumur 88 tahun dan mempunyai latar belakang penyakit darah tinggi, penyakit jantung dan demensia. Beliau mempunyai sejarah kontak rapat dengan kes positif COVID-19 iaitu kes 1684. Beliau telah dirawat di Pusat Perubatan Universiti Malaya pada 20 Mac 2020 dan disahkan meninggal dunia pada 10 April 2020 jam 2.38 pagi. Takziah diucapkan kepada semua ahli keluarga mereka. Kementerian Kesihatan Malaysia ingin memaklumkan bahawa Institut Perubatan Forensik Negara telah menjalankan satu bedah siasat terhadap satu mayat kes COVID-19. Bedah siasat dijalankan di bawah Seksyen 16 Akta Kawalan Penyakit Berjangkit 1988 iaitu Akta 342. Penemuan bedah siasat mendapati terdapat virus COVID-19 dikesan pada permukaan badan mayat melalui analisa real-time polymerase chain reaction yang dijalankan oleh Institut Penyidikan Perubatan. Virus juga dikesan dalam organ dalaman, air kencing dan juga cecair badan. Penemuan baru ini adalah selaras dengan pandangan yang dikemukakan oleh Kementerian Kesihatan Malaysia sebelum ini dan dipersetujui oleh Mesyuarat Jawatan Kuasa Muzakarah Khas Majlis Kebangsaan bagi Hal Ehwal Agama Islam Malaysia yang telah bersidang pada 15 Mac 2020 serta Majlis Perundingan Malaysia Agama Buddha, Kristian, Hindu, Sikh dan Taois pada 16 Mac 2020. Tata cara tersebut merangkumi pengurusan jenazah Islam di mana hanya dibenarkan untuk ditayamum di atas permukaan beg jenazah. Manakala bagi mayat bukan Islam, apa-apa upacara keagamaan dan tradisi hanya dibuat di atas permukaan beg mayat. Perintah Kawalan Pergerakan diperketatkan mula dilaksanakan di beberapa lokasi yang berisiko tinggi. Misalnya Bandar Baru Datuk Ibrahim Majid di Simpang Renggam, Keluang yang merupakan lokasi pertama berkuat kuasanya Perintah Kawalan Pergerakan diperketatkan iaitu pada 27 Mac 2020. Sebanyak 1,634 ujian saringan COVID-19 telah dijalankan di mana 138 kes didapati adalah positif COVID-19 dan 1,496 adalah negatif. Adalah dimaklumkan bahawa 79 kes telah dikesan sebelum PKPD manakala selebihnya 59 kes positif telah dikesan selepas PKPD dikuatkuasakan. Terdapat 3 kes kematian COVID-19 dari kawasan ini iaitu kes 1114, kes 1251 dan kes 2627. Kawasan sekitar Bandar Baru Datuk Ibrahim Majid telah dikenal pasti buffer zone iaitu meliputi kawasan Kampung Datuk Ibrahim Majid, Kampung Parit Penghulu, Kampung Parit Saleh dan Taman Seri Bayu yang dianggarkan mempunyai penduduk seramai 1,800 orang. Pengesanan kes secara aktif telah dilaksanakan atas sekitar 1,500 orang dengan 359 orang daripada mereka telah menjalani saringan sampel berdasarkan penilaian risiko. 13 kes didapati positif, 88 kes negatif dan 258 kes dalam proses ujian makmal. Pelbagai aktiviti telah dijalankan semasa tempoh PKPD, termasuk bancian penduduk, aktif case detection daripada rumah ke rumah, pengambilan sampel, aktiviti disinfeksi berkaitan dan promosi kesihatan. Jadi Kementerian Kesihatan Malaysia menyambut baik pelanjutan 2 minggu Perintah Kawalan Pergerakan seperti yang diumumkan oleh Yang Amat Berhormat Perdana Menteri sebentar tadi. Ini akan memberi peluang dan ruang kepada kerajaan untuk memerangi penularan COVID-19. Sebelum kita dapat menilai semula tahap keberkesanan serta keadaan semasa jangkitan COVID-19. Berdasarkan pada situasi terkini COVID-19 di Malaysia, didapati pelaksanaan Perintah Kawalan Pergerakan telah dapat membantu Kementerian Kesihatan Malaysia membendung penularan penyakit ini kepada satu tahap yang stabil. Ini dapat diperhatikan daripada trend kes COVID-19 dan trajektori yang diunjurkan melalui kajian yang telah dijalankan oleh Kementerian Kesihatan Malaysia. Namun begitu, ianya masih di peringkat pertengahan dan masih memerlukan tindakan pencegahan serta kawalan yang berterusan. Malahan, ianya perlu dipesatkan lagi bagi memutuskan rantaian penularan jangkitan melalui peningkatan aktiviti sedia ada serta beberapa pendekatan baru dan khususnya kepada kumpulan sasar tertentu. Ini adalah wajar seperti mana yang telah disebut oleh Dr. Tedros, Ketua Pengarah Pertubuhan Kesihatan Sedunia pada 25 Mac 2020, iaitu tindakan agresif seperti melaksanakan Perintah Kawalan Pergerakan dapat memberi peluang pada sesebuah negara untuk mengharungi jangkitan COVID-19. Dr. Tedros turut mengingatkan bahawa tindakan untuk menamatkan perintah ini dengan terlalu awal boleh mengakibatkan penularan semula COVID-19 di sesebuah negara. Dikhawatiri kes penularan COVID-19 mungkin akan rancak kembali berlaku di kalangan masyarakat. Orang ramai akan terus dijangkiti, warga emas dan golongan berisiko tinggi akan terkesan dan kapasiti sistem kesihatan akan semakin tipis untuk melawan gelombang yang mungkin lebih besar daripada apa yang kita lihat setakat ini. Sekian, terima kasih. Kalau ada apa-apa soalan, silakan. There are more than 2 MOF staff in quarantine. We do have a list. Those who actually have been exposed, for example, I informed earlier, 20% of staff have been exposed, particularly when they are serving in the hospital or clinic, and the patient did not inform them, for example, of close contact with a positive patient, and when we test them, they are positive, or some of our staff have a close contact with a positive patient, then the whole department has to be screened and action been taken. So they will be put on quarantine for a period of 14 days.
What are the numbers for those screened, tested positive and negative for the Sri Petaling cluster?
So for Sri Petaling cluster, the list is, I think, if you look into the Sri Petaling cluster, I think now that we are looking into more than the cases that has been informed, and action been taken for the cluster. But now we are not involving the index case, but mainly we are looking into the family members as well as the close contact. As we mentioned earlier, the whole network of cluster related to the 756 cases of the index cases are related to the family members and the close contact. So we do have names of more than about 40,000, those who have not been infected. But when we look into the family members of the index case, for example, so we are looking into the potential family members that can be infected. So the list is about 40,000, and then we make sure that we educate them if they have any fever or symptoms, come forward for us to do the testing.
But what are the numbers of those who have been tested? How many was
I'll give it to you, the details, because every day we have these numbers, you know.
Yeah, my question is, all people are concerned about the curve of the pandemic. When will the peak come, and how many cases will have at that time, and also what will happen in the upcoming 2 weeks?
We have seen some of the modeling been done, like from JP Morgan and also Malaysian Institute of Economic Research. For the prediction from JP Morgan is that on the 14th of April, that we have a peak. Basically, about 6,900 positive patients, 14th of April. Today, and JP Morgan's modeling is based on assumption, looking into other countries and the distribution, and using that distribution in the initial phase, and to explain that our projection is about 6,900. Malaysian Institute of Economic Research, for example, they are using the modeling and looking into the prediction of perhaps we are getting around 8,000 or 9,000 patients within the next 1 week. But what is the reality is that we are looking into our cases, monitoring it very closely, and although from Malaysian Institute of Economic Research and JP Morgan, they are based on assumption. But our analysis based on reality, that means we are using our daily data and key in the data as accurate as possible. And if you can get a very accurate data, then you can have a better prediction. Now, our prediction have shown that our trend are quite stable at the moment, and we did not see any exponential surge. And perhaps also we might have the peak. For the last week was perhaps our peak, because now you see that our cases are getting less and less. So that is a good sign for us. Then we have our prediction as well in terms of the infectivity. Before the MCO be implemented, phase 1 or phase 2, we have calculated our infectivity of R0. That means R0 is 3.55, which means that if one person is infected, and he will infect 3.55 people. That is the R0 initially before we implemented. Now, when we look into today, and we are monitoring very closely, we managed to bring down the R0, which means that the MCO phase 1 and phase 2 is very effective for us to bring down the R0, because when everybody stays at home, the infection will be less. So the infectivity will be less as well. So the R0 from 3.55, we brought it down to 1. And we expect on the 14th of April, the R0 will be 0.9. So if it's 0.9, that means they are not infecting 1% positive, they are infecting only 0.9%. So less than 1% been infected, which means we are able to control the infectivity of this COVID-19. So what we intend and we advise the Prime Minister is to extend another 2 weeks of the MCO. By extending the 2 weeks of MCO, it gives us more time to put our action, our activities, and to make sure that we can contain and we can actually break the chain of infection, meaning to bring down the R not further down than 0.9. So if that's the case, we are on the right track. So from the experts from the public health, perhaps we need to consider 3 cycles of incubation period. So which means incubation period of 14 days. So we need about 6 weeks.
Yeah. So one more question is, you announced that there are more than 400 foreigners infected, confirmed infected. Among the foreign infected person, there are 25 Chinese citizens. I think except for the 15 tourists in the Spring Festival around, there are more Chinese citizens infected. Could you tell us details and how their conditions now? Thank you.
Our first case was reported way back in January 2025, if I'm not mistaken, whereby the index case was in Singapore. So we were informed by our counterpart in Singapore that one family, one group of tourists from China came to Singapore, and then from there, the rest of them came to Johor Bahru. So that was on the 25th of January, and that's where our first case detection was positive. And since then, we have almost about 22 of our patients been detected positive, of which 16 of them were Chinese from China. So what is more important is 5 of the local Malaysian and 1 American. More importantly is that they indirectly have association with the Chinese from China. So the infection then was involving 22 positive patients, and we managed to treat them well, and all of them has been discharged. And then we have a gap of 11 days. We have no patient at all. And so they say the calm before the storm. And we got our case 23rd, who came back. She came back with a family from Tokyo, for example, for a tour in Tokyo, and she was positive. Then case 24 is a Japanese lady living in Malaysia for the last 3 years, also been back to Tokyo and Jakarta. And case 25th is the same, have a history of travel before. So all the cases that we've seen after the second wave is basically they are imported cases. So the concern that we have then is imported cases will be increasing, and they are the one that will bring back the infection. So at that point of time, apart from China, so we have started denying entrance of the tourists from China, for example, from Japan, those who are going to Japan, and Korea, a few countries, and Italy, and Iran, and Korea, and these are some of the countries, 5 countries we have been identified. But today you see the infections already cut across more than 180 countries. So our fear is that when the tourist comes back overseas, and they will bring back, or even our local Malaysian coming back from overseas, they will bring back the disease. So the first initiative that we have is the border control. That means if it's the foreign tourists, we deny entry. Then, but the local, we have no choice but to quarantine. We quarantine at home initially, but now it's a mandatory quarantine in a place been identified by us. Then control of movement. So the first is border control, second control of movement. And this is where we have suggested the MCO, phase 1, phase 2, and phase 3. When we control the movement, then we can break the transmission from one individual to another individual. So and the community must come together in terms of to avoid public gathering, social distancing, frequent hand washing. These are some of the activities that we suggest all rakyat Malaysia to do it. So hopefully by doing so, we can break the chain of the infection of COVID-19.
But how many Chinese citizen patients in hospital now?
Chinese, basically now, only we've seen the Chinese citizen in the first wave. In the second wave, majority Malay, and yesterday we have announced that foreign nationals, about 416 if I'm not mistaken, but majority is still local.
There is no Chinese citizen.
So far we have not documented. Right?
Okay.
So mainly because we already stopped from the 18th of March, stopping any tourists from China or other countries coming to Malaysia.
Doctor, of the number of patients in the ICU or on ventilator right now, how many have recovered and how many have died?
So from ICU, we're just looking at percentage. So out of the total percentage that we have today, if you were to look into cases, we have 4,346. 4.9% of them been managed in the ICU. And the mortality, as I mentioned earlier, is about 1.6%, so you can do the calculation there. So the rest, discharge is about 30 to 40%, so that is our discharge. But some of them already out of ICU, but still been managed in our COVID ward until they are negative for more than 24 hours. So if their test is negative more than 24 hours, then only we discharge them. So the reason is now if you were to look into the cases that been discharged, almost about 42.1% from the ward. So out of 1,830 cases of discharge rate, about 42%, 42.1%.
This is from the ICU.
Yeah. No, this is for total cases.
What about
ICU is only at 5%. You can do the calculation there from 5%. 4.9% to be precise. So you calculate 4.9% of the total been managed in ICU. And the mortality is 1.6%. Right? So you can calculate from there. And discharge from that group, about 30%, 30 to 40%. But the rest are still managed in the COVID ward.
Datuk, saya ada dua soalan. Soalan pertama, pada 7 April hari itu, Datuk ada kata yang sikit kita berkurangan dan boleh untuk masa seminggu. So, apa status sampai setakat ni? Soalan kedua, apa SOP KKM untuk memantau pesakit-pesakit yang dah pulih, memandangkan DG CDC Korean menyatakan ada 51 pesakit yang dah discharge. Dia reoccur balik penyakit itu. Dan situasi yang sama berlaku di China juga.
Okey, kalau yang soalan pertama mengenai kes yang kapasiti makmal harian yang kita ada sekarang ialah setiap hari kita dapat melaksanakan lebih kurang 10,329 ujian sehari. Tapi kapasiti kita, keupayaan kita boleh tingkatkan lagi ke 11,546. Jadi daripada 43 makmal yang kita ada. Jadi makmal kita sekarang ni kita lihat bagaimana kita dapat meningkatkan kapasiti makmal kita. Dan mungkin ada masalah reagen, tetapi kita telah melaksanakan beberapa strategi untuk kita meningkatkan keupayaan makmal kita. Yang pertama, kita meningkatkan mesin otomasi makmal COVID-19 yang sedia ada. Jadi kalau kita guna automated, boleh kita laksanakan ujian kita dengan lebih cepat dan lebih pantas. Yang kedua ialah pertambahan peralatan di makmal COVID sedia ada. Dan ketiga, menggunakan jin expert yang sedia ada. Dan yang keempat ialah perolehan jin expert tambahan bagi perluasan makmal-makmal yang lain. Dan kolaborasi dengan Angkatan Tentera Malaysia, MOSTI, makmal-makmal universiti dan juga makmal swasta. Dan kita juga ada makmal mitigasi yang berinput tinggi, contohnya dengan kerjasama dengan BGI. Dan kita evaluasi sekarang ni kita masih dalam peringkat membuat penilaian dan verifikasi rapid test kit antigen. Dan jadi mungkin dengan penilaian kita dari semasa ke semasa, kita harap dapat atau kenal pasti satu test kit yang tepat dan juga reliable. Jadi setakat ni kita tak jumpa lagi test kit yang tepat dan reliable.
Masih memadai untuk kalau situasi ni prolong, memadai?
Setakat ni memadai sebab kita dari segi reagen kita dapatkan perolehan secara pukal untuk mendapatkan banyak lagi reagen. Dan mungkin kita dapat berkongsi sama reagen di antara universiti ataupun dengan Kementerian Kesihatan. Jadi kita tengah berurusan dengan perolehan tersebut. Tapi kita yang penting ialah menggunakan ujian RT-PCR, iaitu jangka masa ujian itu memakan masa. Contohnya 6 jam sekurang-kurangnya. Tapi kalau jumlah kes bertambah, maka keputusan ujian pun lambat, mungkin dalam 24 jam ataupun 48 jam. Hatta sekali kalau kita lihat di hospital swasta pun jaminan mereka ialah memberi ujian tersebut dalam tempoh 24 jam. Ada kala mereka juga tak dapat memenuhi tempoh 24 jam tersebut. Jadi kita kena lihat satu ujian yang cepat, cepat dan tepat. Jadi cepat dari segi turnaround time. Kalau kita dapat laksanakan satu ujian COVID-19 ni dalam tempoh masa setengah jam ataupun 1 jam, itu dah paling baik. Tetapi setakat ni kita tak jumpa lagi ujian rapid test kit yang dapat berkesan dengan ketepatan yang tinggi. Dan yang kedua ialah dari segi point of care testing. Berarti kita tak payah hantar spesimen tu ke makmal. Jadi kita boleh laksanakan ujian tu dengan cepat dan tepat di tempat tersebut. Contohnya di klinik ke ataupun di hospital. Jadi kalau kita dapat laksanakan ujian tersebut, maka lebih memudahkan kita untuk mendapatkan ujian dengan cepat dan pending cases pun akan kurang sebab pending dan menunggu keputusan. Keputusan lebih pada 24 jam, 2 hari pending contohnya. Jadi kita masih dalam proses melihat. Hari ini kita ada satu test kit daripada Korea lagi dan canggih, dan kita dah didaftarkan dengan IMR, dan mungkin sehari 2 lagi kita akan laksanakan ujian klinikal supaya memastikan kes-kes ini yang kita gunakan ujian rapid test kit ni berkesan. Sebab kita tak nak ulang kesilapan, contohnya di negara Sepanyol, dan baru-baru ni kita maklumkan di UK juga mereka membeli rapid test kit, dan bila sensitivity dia kurang, jadi false negative dan false positive. Kalau kita ada false negative dan false positive, ada kemungkinan yang negatif kita kata positif dan positif kita kata negatif. Yang mana kita kata negatif sebenarnya positif. Ini uji semula dengan RT-PCR positif juga. Dan ini mungkin jadi ada ketidakketepatan dari segi melaporkan ujian. Jadi apa yang penting ialah ujian yang kita guna mestilah tepat dan sebolehnya cepat.
You mentioned the Korea test kit that you received today. Is this the second?
The second one, that's right.
It is said that Chinese medical team will come soon to support Malaysia. Could you tell us the detail about this? The Chinese medical team will come
Chinese
soon.
medical team, yes.
Yeah.
Next, I think in 2 weeks' time, the Chinese medical team will be here, and basically they will see the performance of our hospitals as well as to share experience, because they have been through the process of handling COVID-19. So experience in terms of public health, in the hospital, as well as the test. So they are here not to run our services. They are here to visit us and then to share experience. Again, we have a discussion with them in terms of how best we can improve our services. Right, our services in the hospital, for example, how can we increase our efficiency in the hospital? And we all know that China, within 10 days, they can build a hospital. But today, you know that within 3 days, we also can build a 600-bedded hospital, but not a temporary hospital. So, more importantly is that sharing experience, you see, for those who have gone through managing COVID-19 in their own country. And some of the initiative they have done is unprecedented. We have not seen. So we would like to listen to them and learn from them, and perhaps they can learn from us as well. This is where sharing on both sides is important. So that's one in terms of services. Then we are also looking into how we can actually collaborate with China and to look into research. And research means today we are looking at the virus. Can we isolate the virus? Now, if we can isolate the virus and we can do the whole genomic sequence now, then we can actually identify the virus. So we ask ourselves, because this is a new virus, so nobody has the identification of this virus. Are we seeing this virus from Europe, from China? We don't know. Say, for example, in Zika, we know the list of Zika. We have a local Zika. We know the genomes of Zika from Brazil. We know the Zika from other countries as well. So we need to identify the virus. That's why we need to isolate. And then we can share a lot of testing, for example, in terms of technique of testing. So again, this is an opportunity for us to learn, work hand in hand, sharing information, and see how we can collaborate, and for us to move forward to deal with COVID-19.
Yeah, and from the statistical data, we found that in Malaysia there's less patient in ICU and much more less number in fatality. So could you share the Malaysia's experiences?
So far, we look into our cases now. Again, are we looking into different strain of COVID-19? And it's been reported there the S strain as well as the L strain. So again, we need to isolate the virus to study our virus of COVID-19 in this country. So that process is ongoing. But more importantly, if we were to look into the different strain of the virus, then we will take time for us to come up with the research and identification. It's very challenging for us in this period of time. And looking into the cases, definitely the cases are slowing down. But what's more important that our cases, 88% of cases have positive and mild symptoms, 88%. But we are not sure of this 88% which patient will eventually becomes moderate or critical. Therefore, positive patients being observed in our ward in the hospital. Then, when we look into the utilization of ICU, we also realize that only 5% or 4.9% to be precise needs ICU management. And as compared to other countries, maybe 10% or maybe more than 10%. So it's only 4.9%. And out of this 4.9%, needing ventilation is actually less than that. So we don't know what we are looking at. Is it because we are looking into different strain of virus? We don't know, right? Unless we have isolation, then we can actually study the behavior or nature of the virus, whether it's X strain or L strain, as we mentioned earlier. But what we do know is that our utilization of ICU less than 5%. Perhaps because we manage the patient early, meaning we detect the patient early, and before they have symptoms, we already admit them to the hospital. Only a few countries, I mean one of our services that when you are positive, our ambulance will come to your home and then pick you up and send to the hospital. Then, although you have no symptoms, but the test shows that you're positive, we will isolate you and then we will treat you. So we will manage you in our hospital and ward and observe you closely. And before you deteriorate, we already know when, and then we will do the appropriate treatment for you. And also, I must admit that our intensivists, our anesthetists in the ICU, they're performing a brilliant job in terms of treating the patient. And as I said again, all our ICU beds, we have increased the capacity. 7 hospitals, COVID hospital, ICU from 44 beds, we can increase to 112 beds. And we also have 65 specialists from the private sector join us in the public sector during this period of time. And we have 909 nurses joining us as well from the private sector, or those who have retired join us to provide the services. So we have a good teamwork, and especially ventilators. We have 70 ventilators from the private sector loaned to the Ministry of Health. As far as ventilators, we have more than 956 ventilators available. So we do not have shortage of ventilators at the moment. And from the engineering department, I'd like to thank the engineering department and those involved. They come up with innovation. 1 ventilator can be used for 2 patients. So with that, we have increased the capacity of ventilators of 100%. So again, we also rely a lot of innovation in our setup, and this is a good positive innovation. And also our expertise. Do not forget, the most important asset of any organization, especially in the Ministry of Health, is a human resource. So our doctors are trained to do so, and I'm sure that our doctors are able to handle.
In managing people at EMCO or quarantine centers, have your ministry faced uncooperative or rude people, as we have seen some examples on social media? And what are the examples, if there are any, and how do you address this? And maybe a message to the public to treat your frontliners a bit more kindly.
So far, when we implement an EMCO in three areas, Simpang Lenggam, Sungai Dui, as well as in Menara City 1 Kondo, we do not have issues with regards to inappropriate behavior from our patient. But more importantly is that we want to inform the public that we are there, we have to engage with them. Why we have to do the test? To protect them. It's not that we are trying to do things against their will, but basically what we are doing is to protect them. We identify them, we trace them, and then we test them, isolate, and we treat them. So very important basic skills in terms of human to human is engagement with our patients, engagement with the people, engage and explain issues and challenges so that they understand why we have to do the test for them. We are doing to protect them so that they do not infect other people, especially their loved ones, their family members, etc. And we have to manage their expectations. So if we can manage the expectation of our patient are happy because we can deliver better. So we can see from the social media and all, some of patients that has been discharged, they share their experience in terms of, and we also learn from them how can we improve further. So it's both ways. It's not we treating them; they are our partners to treat the patient. So we always engage with the patient, what to do, what not to do, explain to them all the issues and challenges, and they are part of the team to manage the COVID-19. So this is where I think engagement is important. And the same message we want to tell the people out there is that when we come to you, it's because we care for you. That's why we want to test you, so that we prevent you from infecting your family members, and we prevent you from infecting the community.
Datuk, berkenaan soalan saya tadi, apa SOP KKM gunakan untuk pantau pesakit-pesakit yang dah discharge, yang boleh memandangkan dekat ini DG CDC, Korean CDC ada mengatakan 51 foreign patient dia dijangkiti semula.
Jadi sebelum pesakit kita dibenarkan balik, kita akan adakan counselling walaupun dia dah negatif 2 kali dalam tempoh lebih pada 24 jam. Dan sebelum kita balik, kita juga akan memberi counselling kepada mereka, iaitu pertama, mereka kena amalkan social distancing, dan kedua, sentiasa mencuci tangan, dan ketiga, cuba elakkan public gathering dan sebagainya. Jadi counselling tu kita maklumkan kepada mereka boleh dijangkiti kembali. Walaupun biasa dia kita lihat mereka dalam walaupun dah dikesan antigen tu negatif, ada kalanya antibody tu tak cukup. Dia ada antibody tapi tak cukup untuk mereka kalau dijangkiti semula. Jadi the antibody is not protective yet. So kadang-kadang kalau kita lihat, kalau kita dah dapat immunization dan kita kena ada booster untuk dapatkan antibody yang lebih, jadi ada kemungkinan mereka akan dijangkiti, tapi peratusan jangkitan semula tu tak tinggi. Jadi kita harap mereka dapat mencegah daripada dijangkiti daripada merawat ketika dijangkiti.
KKM ada minta diorang report ke?
Ada, kita ada follow up macam biasa. Kalau yang mereka daripada luar negara, jadi tak ada follow up. Contohnya daripada negara China, kita dah discharge. Jadi daripada 416, biasa dia kalau kita dah detect positif, kita akan maklumkan International Health Regulation negara berkenaan. Contohnya kalau kes satu positif, Malaysian positif di Brunei contohnya, dia akan maklum pada kita. Sama juga kalau kita dalam jemaah tabligh hari itu ada 25 negara, kita maklum pada 25 negara IHR tu. Sama juga kalau 416 kes yang positif, kita maklum pada IHR, International Health Regulatory Committee di negara masing-masing, yang mana mereka dikesan positif di sini. Jadi itulah kerjasama erat antara Kementerian Kesihatan, iaitu IHR. Kita pun ada International Health Regulatory Committee di Kementerian Kesihatan, dan ini dikelolakan oleh WHO. Jadi kita ada rangkaian network, rangkaian kerjasama International Health Regulatory dapat di bawah payung WHO.
Maksudnya KKM bersedia sekiranya ada patient yang dijangkiti semula.
Kalau patient ada jangkiti semula, kita ada follow up ataupun susulan melihat sakit kembali, dan kita akan lihat sama ada perlu atau tidak ada gejala kembali, dan kita monitoring lepas kita discharge daripada ward.
Betul. Macam ini ada dilakukan wakil rakyat yang turun beri bantuan pada di kawasan-kawasan itu, dia tak patuh KTV, maksudnya tak patuh social distancing and tak lawan cakap petugas kesihatan yang mungkin dia boleh beri.
Jadi perkara ni adalah satu perubahan tingkah laku kita lah. Jadi mungkin makan masa untuk kita dapat melaksanakan ataupun mengamalkan tingkah laku yang baru, sentiasa basuh tangan, adakan penjarakan yang selamat, dan juga kita dah sekarang ni pun tak salam dah contohnya lah, kan? Kita dah elakkan daripada persalaman. Jadi inilah cara baru kita kalau kita nak elakkan daripada dijangkiti. Mungkin mereka tahu, kadang-kadang kita pun tahu yang mana apa yang harus kita perlu buat, apa yang seharusnya kita elakkan. Tetapi untuk mengamalkan ialah satu masalah kadang-kadang. Kadang-kadang kita jalan, kita tak sedar yang kita ada kumpul kat situ. Jadi Jadi yang penting kita selalu mengamalkan ataupun diperingatkan akan social distancing, selalu membasuh tangan. Kadang-kadang hand sanitizer ada tapi kita tak guna pun. Kadang-kadang kita tahu social distancing tapi kita tak amal pun. Jadi kadang-kadang kita tahu, kita automatik kita nak salam dengan orang. Jadi itu tak jadi kebiasaan. Jadi kita kena ubah cara kita, tingkah laku kita dalam amalan kita seharian. Okey, terima kasih.
segala azabmu. Ya Tuhanku, bimbinglah hambamu dari segala berat ujianmu.